ever suffered from back or leg pain, you know how miserable it can make you. But there is a new FDA-approved treatment for chronic pain, and our next guest just happens to be the first doctor in North Texas to utilize it. Please welcome Dr. Amit Darnule with Spine Team Texas. So nice to have you with us.
Thank you for having me, Jane.
Okay, what exactly is this new therapy?
Well, HF10 therapy is one of the newest advances in spinal cord stimulator technology that's just been recently released and FDA approved. We've been using spinal cord stimulator technology for over 40 years to treat patients with chronic back pain and leg pain symptoms, and it's the newest one on the market and has some unique advantages over what we were using before.
So people with chronic back pain, chronic leg pain, anybody
correct.
else who benefits from this?
For this particular device, it's chronic back and chronic leg pain symptoms.
Okay.
Yes.
What is the traditional treatment for this?
The traditional treatment for chronic back and leg pain symptoms, when I think about that, I think about physical therapy, chiropractic care, massage therapy, and then also using things like low-dose medications, spinal injections, and in the right cases, surgery can be appropriate for treatment.
Really painful problem for people who have it. So how does this spinal cord stimulation HF10, is that what you said?
That's right.
How does this work?
Well, for patients who've tried all those traditional treatment options and just haven't gotten the relief that they were hoping to get from it, or have had partial relief or still struggling with pain, this may be a viable option. What stimulation does is it creates a small energy field that influences the pain signal as it travels through the spinal cord before it reaches the brain, where we interpret it as pain and suffering. HF10 therapy is unique in that it uses a high-frequency system rather than the low-frequency system that we've been using before. Low frequencies create a paresthesia. It's like a tingling or buzzing sensation in the area where the patient has pain. And while that might be appropriate and a welcome relief for patients who are struggling with pain, there are some patients who it's just not for them, or they don't really like it, and for them it can be a struggle. So the HF10 therapy, using that higher frequency setting, is able to block that pain without creation of that tingling or buzzing sensation. So people can use it like when they sleep or when they drive, and it's a little bit easier to use.
So explain the procedure required if you're a candidate.
Well, if you're a candidate, we want to make sure that it's the right thing to do. So we do what's called a trial. It's like a test drive. We place a needle into the epidural space, similar to how we do many other pain injections. But instead of injecting medication, we advance a small little catheter. The catheter, we call it a lead, and through that we can send the energy signals through. During the trial, we don't do any type of surgery. What we do instead is we use an external version of the device, let the patient use that for about a week or two, about 5 to 7 days really. And at that time, they're measuring how much pain relief they get. We're looking for big changes, 50% relief of pain, improvement in their sleep, improvement in their function. And if that's the case, then we consider moving forward with the implant phase.
So what kind of advantages have patients who've used this seen?
Well, we're seeing marked reductions in pain in their back and legs, greater acceptability of use because they're not necessarily feeling that stimulation, improved sleep, improved outcomes. And because we can test and trial the device, patients know what they're going to get before they actually go through and have the permanent device in. One of the big advantages, I feel, is that it's a reversible procedure. So while this battery is approved and can be used for almost 10 years, the big thing is we don't know what's going to be out in 10 years. And so people don't have to feel like they're making a commitment now forever. We're able to use this, and if something were to be better out in the future, 10 years from now, we can remove this device and they can still be open to new treatments.
So if someone's watching and thinks that he or she may be a candidate for the therapy, what should that person do?
Well, they should, we'd like to see them in an appointment. A consultation will help us decide if this is the right next step or if there are other treatment options available, because it's really about choice. And we want to make sure the patient has all their choices ahead of them, and if this is the appropriate next step, we'd love to talk to them about it and go through with the trial to see if it works for them.
Well, thank you very much for being with us today, Doctor.
Thank you for having me, Jane.
If you suffer from chronic spine pain, contact Spine Team Texas to see if you qualify for this unique treatment. There are 6 locations across North Texas. You can log on to spineteamtexas.com or call 888-512-3892 for more information. Thank you, Doctor.
Thank you, Jane.